industry specific problems we're trying to solve. I've got two really strong experts in the medtech area that have developed a product that is really game changing for businesses trying to tackle sickness, and leave and absence, that kind of thing. So I wanted to introduce Jitendra and Eric to you. They are the co-founders of ESB. Eric, nice to meet you. I thought I'd let you introduce yourself first, and introduce the business and why you formed it, really. So we'd be really keen to get a bit of an intro on you first, Eric.
Yeah, well, nice to meet you too, Jonathan. So the idea behind the business was that, as in most sectors, there are some processes that can be automated. Okay, and what we wanted to look for, or I specifically wanted to look for, was a sector where these automations can reduce time, provide the greatest possible return on investment and return on quality. Healthcare is probably one of the first that come to mind, given that the more time you have, the more time you can spend on taking care of patients, which means that the quality of care goes up, and which means that you can take on more patients in the same amount of days, for example. This is why we decided to go forward with healthcare. The idea of using AI also, well, this is the technology of the time, we might say. I would also add that many processes, especially in healthcare, are highly regulated. And because of that, given that regulations most of the time include even steps, they are easy to automate. It's not like something, oh, it's different for everyone, like it may be in a more creative sector, for example. It's just going to be, these are the steps, this is how you do it. You give it to AI, you just say, okay, AI, these are the steps, this is how you do it, based on the regulations and the laws that are there. So the idea, yeah, just to sum it up quickly, was let's have some impact, but let's also not destroy ourselves in doing something that's impossible. So yeah, looking at the team, I decided to do this. I needed a high quality team, so I started looking at on LinkedIn, to be fair, for people that, due to their backgrounds and experiences, could help me get this. This is how I found people like Jitendra and the rest of our team, which have been great and are currently also being great helpers in all manners of management, let's say.
Amazing. I mean, it must be quite rewarding as well, the fact that you're doing work that's having a real benefit to society, people, the way we live. The medtech I find so fascinating because it just has such an impact, a genuine impact on our lives, right? So yeah, congrats on the idea, for sure. We can obviously go into a bit more detail on the idea and the problems we're trying to solve. Jitendra, I'd love for you to put your voice on here and introduce yourself as well. Jitendra, tell us a bit about yourself.
So first of all, when Eric was looking for quality people, I think he must have had a brain lapse on the day he came across me. Okay.
I'm sure that's not the case.
So I just want to clarify that right at the offset, right? So I'm for my sins, I'm a qualified chartered accountant for many years now. I've trained with the Big Four, etc., etc. But more importantly, I think the important thing to realize is I was born in East Africa. I came here at the age of 8 and 2 days actually, without any education whatsoever, and learned how to speak English and spell and everything, reading Economist and Open University and etc., etc. At the age of 10 or 12, I was watching Open University at 4 o'clock in the morning. Anyway, the rest is history. Went to university, blah, blah, blah. But I think the more important thing here is I've never let the Institute of Chartered Accountants mold me into a typical chartered accountant. I think first and foremost, human beings are the most important thing on this planet. And because they can't value them, they lose them off the balance sheet, which doesn't sit well with me. So I've never molded myself into a chartered accountant. I think human beings are the most important thing. So without much ado, when Eric asked me to do this, I was like, sure, fine, I'm coming up to my retirement, etc. But I need things to do, and etc. So hence I came on board. And we have a great team of people, some of which are in Switzerland, which is a great place to be, especially when you're doing healthcare and private healthcare, etc., and also in the UK. Since then, I was brought on as CFO, but I'm now doing a lot in terms of product development and heading up the sales team. But with regard to product development, one point I want to make very, very clear at the offset is, irrespective of what Eric said about trying to optimize everything, blah, 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 it's become very clear to me, and I think to Eric to a certain extent, if not completely, is that we have an ideal opportunity here with skill sets within the team, but with the technology that we have at hand, i.e. AI, to help give back something to humanity. Especially for me, Africa is where I was born, India is where my heart is, and UK is where I got educated. So, and I'd the way our National Health Service is working at the moment, I could probably count all those 3 countries in need of people who can't really afford healthcare, blah, blah, blah. And so I want to make it very clear that it's certainly our personal ambition to try and get this product out, the chatbot, the companion, to as many people as possible for free. If they can't afford it, we're happy to give it to them for free. It's not an issue. It really isn't about the money at that end of the business, which is the B2C, okay? Yes, of course, we'll hope then they will move on to subscription. Some of the middle class, blah, 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 would move on to subscription-based basis, etc. That's fine. So that's the B2C side. The B2B side is what we're going to really talk about today, which was, to try and solve problems that are happening in the business end. And again, bringing my business acumen to this process, I said, okay, well, look, it's great trying to sort out people's health issues, etc. But, how do we get businesses on board? How do we get nations on board in terms of saving the natural wastage in terms of sick days? Which, to the UK economy in 2023 was 73 billion pounds lost in sick days. Okay, 73 billion. Even if we can make a 1% change to that, that's a lot of zeros after 73.
Yeah, that's a massive, massive number.
Yeah, and that's us. Forget, then let's talk about USA, France, India, some other countries. The amount of value, or from a planet point of view, the sickness costs is phenomenal. And if we can use that money, not that it will, but notionally, if that money could then be diverted towards, or even generated by us for some way, and then diverted to things that really matter, which is healthcare, etc., wellness, mindfulness, etc., then I think we've served our purpose, or I would have definitely served my purpose on this planet.
That's such a powerful statement there as well, Jitendra. And gosh, I was unaware of the costs that sick days have. I know that even in this day that we get a lot of remote working, right? And I'm sure that really helps reduce sick days. So I would love to even know the figure before COVID happened, and businesses were 5 days a week in the office. I'm sure that the sick rate would have been even higher for sure. So let's just talk about the bigger problem here, what we're trying to solve. So we touched on the numbers in terms of the cost of sick days as a collective. What's the wider problem here we're trying to solve? Talk me through why we kind of created this product.
So with that number in mind, in terms of research for the UK only, and bear in mind we're looking at hitting the Swiss market and the UK market first, because that's where our origins are, for want of a better word. Employee absenteeism and delayed access, and it's getting even worse in terms of NHS access to medical advice, etc. As a financial controller, I've seen that whole process of sick leave, and then self-cert for a week, 2 weeks, and then paper copy and give it to HR, etc., etc. And because of my systems background, one of the things we want to try and do is take all of that noise out of the system. So we're actually trying to change how we operate when it comes to sickness and sick reporting, and how companies interact with that in that whole process. So just like we've now stopped, or people have now stopped smoking on planes and in public places, which was like, oh, that's never going to happen type thing before. We're taking on the gauntlet on that one and saying, okay, well, you don't need to call your boss when you're sick. Your boss is not a qualified doctor to assess whether you're sick or not, and all that nonsense. And there was the threat of calling your boss is uncomfortable, etc. So so now through our chatbot, you can report your sickness through the chatbot, and it will go straight into the HR dashboard without any new systems being adopted. It will go through Outlook, etc., and appear on the HR dashboard. So and so is off sick in the calendar, and then HR will also then have a box they can tick if they then want that routed back into the person's team calendar, whether it be finance, marketing, whatever. So we've taken out all that knowledge. And again, Eric, please step in if I've missed it. But the bigger thing here is, after 3 days, once we've got people on board and we're working on that, after 3 days, you will have a Teams call as an individual with a real doctor for 10 or 15 minutes to assess whether you need further sick leave. So at the moment, you can get a sick leave and the doctor will sign you off for a week, 2 weeks, blah, blah, blah. It seems to be in buckets of 5 days, whereas after 3 days, the doctor will then assess whether you need further sick leave, etc. But more to the point, if the person generally needs more sick leave or attention or medical attention, they will have a window within 3 days to see a real doctor, albeit via a Teams call, and that is a much better position to be in than staying at home for 5 days and then saying, oh, I have to go to the doctor if I want more further sick leave, etc. So we're taking out of all those things, and also certain sicknesses people are reluctant to talk about. Okay, so they're hesitant for emotional or mental stress, and there's a big thing about men and mental stress and not being able openly talking about all those things. With the chatbot, you can talk to the chatbot. It'll give you advice. Not only will it give you advice, it will give you natural remedies. And now, again, because of my background in terms of Ayurveda, etc., we're also building in Ayurvedic, which is all about body balance, etc., recommendations as well. On top of that, we're building the system which already talks 5 or 6 different languages, but I want Hindi and Gujarati because they're my sort of Indian languages, but we're talking to people in Uganda, so I want Swahili in there. It's easier for a person to talk and get information back, whether it be in text format or audio format, in their own language. So this is going back to things like, getting it out in the villages in Africa and in India and any other country, to be honest. If I haven't mentioned the country, please excuse me. It's not anything else, but it's, whatever country may need it. It could be Ethiopia, it could be anywhere, so Latin America, wherever. But people will understand because it's the language they talk. At the moment, if you talk to a doctor and if they only speak English and maybe another language, then if you try and talk Swahili to them, it's like blank FaceTime. And in fact, that's what we're going next. We're going up on a podcast against doctors, against the chatbot. We'll get the doctor to assess the chatbot's answer, but then we're going to ask the doctor in another language and see what happens.
It's amazing.
And the
You've
reason
got
why we're
such a
doing
global
that,
reach as well, isn't it? You can
yeah,
apply your products so it's a
Yeah.
real global reach.
absolutely. But the reason why we're doing that is not to show the doctor in a bad light. It's to show, look, technology is a tool that we can harness for our benefit, not let it control us, but we control it. So even a doctor who says just speaks English and maybe one other language, doesn't matter what, or even just English, if a customer comes up and starts talking to them in Hindi, they can talk straight into the chatbot, and the doc, and it will convert that, or even the doctor can use that methodology to convert it, and then convey that message back in Hindi to his patient. Do you
Got
see the
you.
power of this?
Yeah,
And
yeah,
that
that's
is a
huge.
phenomenal power for a doctor to have at their hand now. They can liaise in any language, or most languages covered by the world. Eric,
That's
do you want to kick in?
fascinating.
Well, I mean, I think you said most of the things. I know, Jonathan, if you had a question, perhaps.
I was
Go ahead.
going to say it was fascinating around what you can do with technology, and I think it kind of leads us into the next part, which was going to be more around, can we just solve this with a business process, a business process change, or is it technology that's really going to drive this forward? I know we've had this conversation before, but I'd love to kind of share that with the audience and what your thoughts are around, if we need to solve this with AI.
I mean, the idea of using AI is probably just like using AI is not the whole change, but it's the majority of the change. Meaning, yes, I can go on a Zoom call with a doctor. There are services that do that. But is it really that more advantageous than just phoning your own doctor and getting something sent to your email? It's not. It doesn't really change anything. It doesn't improve anything in terms of processes. Using AI does, on the other hand. And here's why. AI allows you to have also the intermediate version. You're not going to call your doctor if you have a cold for a couple of days, but you may ask AI to give you some natural remedies, for example, or tell you what you could do potentially about it, and then send off a sick leave request if you're really feeling unwell. Because there's many times you're sick, but you also feel kind of stupid to call your doctor because you have a fever. Especially if it's like December, everyone's going to have a fever. You're not going to call your doctor and say, "Oh, I have a fever." You just look stupid. Instead, if you ask AI, the AI is going to say, "Well, you can do this and this and this. Also, do you want to take some sick leave?" And you have the opportunity of taking sick leave, skipping the entire process of calling your boss, telling him, "Hey, I have a fever, I can't come in," doing the whole paperwork and everything else. Just going to be automated, with AI giving you a couple of sick days so that you can get better, so you can recoup your energies and everything. And HR is immediately going to know, oh, okay, Jonathan is off sick for a couple of days, and it's verified by AI. This is the main advantage. You can't just change processes. You need technology to actually eliminate the processes.
Mm.
Doesn't really make sense to change what you can eliminate. It's just a waste of time and money.
Yeah, I think that's such a valid point, Eric, for sure. I think, and with AI and its capability as well, there's so much we can do. This definitely looks like a technology solution for sure, in my opinion, but hey, I'm not the expert. So, we kind of touched on the solution in terms of, what it can do, but maybe let's do a bit more of a deeper dive. We're talking about some of the key features, for example. So, I don't know whether yourself or Jitendra want to kind of kick in here about some of the key features of this product.
So before we kick in, I just want to mention something that's very, very critical about this, especially the chatbot. And that is, you can't always get off your bed and go to the doctor or make a call or whatever it may be. But you predominantly will have your mobile phone with you. And so the AI chatbot app is 24/7, 365 or 366 in leap year, companion to you. It's there. not only, and people say, oh, well, you can just Google it, etc. Yes, you can, but Google won't give you the resources, the sources of all the information. And for us, it will be the natural remedy sources and the Ayurveda sources as well. So some people, they just need to know and get on with it. Some people like to know a lot more about whatever's wrong with them or whatever. They can then research that. Some people like to read stuff. Some people like to hear stuff. So we're working on the audio version. Some people like to see the stuff. So we were working on the AI companion, literally talking to you with the lip syncing and everything. So that's the next development on our product. So I just want to make those points in terms of the business solution, the AI, etc. And one further thing, perhaps, Jonathan, that your viewers or you may not get from this is, this doesn't stop just here. This also then goes into the medical profession, which is where the original intent was for this product, is to say, okay, how do we introduce this to the nurses and people who are involved in healthcare, and use technology like bracelets to monitor blood pressure and heartbeat and all temperature and all those good things. So now the nurses, and as you know, in this country, they're up to their eyeballs and then some, including doctors. So we now want to use that technology along with the app technology, which our healthcare chatbot has got, so that the nurses don't have to literally routinely go and check everybody's blood pressure and temperature as we do in the current human process. We need to do it on an exceptional basis. Again, my finance background comes here. We report on variances on an exceptional basis. Okay, we're not interested in if the things are in the norm. It's wasting time. So again, nurses don't have to go and check people. They only need to go and check people who come out of a certain bandwidth for their blood pressure or blood pressure. Okay, so even if that gives them a 20%, 20% of nurses' times are spent on admin. Okay, even if we can make a dent of halving that means they've got one extra day now for patient care, and that's where it should be devoted. Nurses should be taking care of patient care and human beings. Let AI take care of all the admin and non-value added activity.
That is a real problem to solve there, for sure, 100%. I think making the nurses, doctors' life easier is only a good thing. My mum, she's in the NHS. She works in the local general practice, and there is a huge demand. I feel so sorry for the nurses and doctors out there that are just under so much pressure and under so much scrutiny as well, because let's face it, you only moan when you've had a bad experience, and that bad experience could be something that's just, I was waiting on the phone line for 10 minutes to get put through to my surgery, for example, and they're only minor things, but no one says how great their experience is from medical, because they just expect it, in my opinion. But maybe you might think different.
So Jonathan, here's the kicker. That's exactly the point I was trying to make, right? They get calls, oh, I've got this, I've got that, I need the doctor to call me back to tell me what's wrong with me, blah, 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 blah. It's endless. And it's frustrating because you can't even get through, right? Trust me, I know, because sometimes I can't get through to my doctors. So if I had a companion that I can just ask and get instant relief for the majority of cases, and then if I'm not satisfied, at least it'll tell me what to do next in terms of steps. We'll also build in, once we got the platform going, here's a doctor's near you that you can call and have a 10-minute session with them if it's that urgent, rather than go to A&E and whatever. So you'll talk to a real doctor. So what we're trying to do here is we're using AI as much as we possibly can, okay? And then we're trying to then bring that same technology to bring in a human being as and when needed for the value-added interaction, which possibly only humans can give to a certain extent, once AI can go no further, if that makes sense. Right?
So
Can you imagine all of those calls now not going to the surgery anymore and being fielded off by this chatbot? You know, we should do a video on this, Eric. We should see a GP surgery at 9 o'clock in the morning, 8 o'clock in the morning, and like no call before, buzzing calls, and now she's trying to read a book. She's reading a book happily with a cup of coffee, and no one's calling. That's the video we need to do, a before and after.
Yeah, I think that is a massive, massive pain for sure for everyone. I think it's a really, really fascinating product. I think it got so much benefit to it, and it also helps. It gives employees a better experience of working for a company, right? If you are getting that level of service, that level of understanding of sickness, you can't help it. You always have that kind of stigma, certainly in some of the industries I've worked in, you take a sick day, oh yeah, they're just hungover or whatever, and does have that slight stigma around it. And I feel that it's really, really decent for companies to recognize sickness is generally a thing. It's not just being lazy, that there are times we need to take time off, and to have that support as well, I think is absolutely brilliant, guys. So what's the type of results we can expect? What can we expect from trialing out your product?
So here's the kicker. Bringing in finance again. Forgive for this, okay? If we take a payroll cost, okay, even if we make a 1% improvement, we're talking a lot more than that. We're talking 20, 30%. But even if we make a 1% improvement to a company's payroll, say you got a 500,000 payroll, right? Or 1 million payroll, just make it easy. We're not talking about a big company. We're talking about a very 20 employees or whatever type company, million payroll. That's 6 noughts. Take 2 off, you still got 10,000, right? That would be the benefit. Now, it's not a big deal in 1 million payroll, 10,000. It's only 1%, still 10,000. Our chatbot will cost the company, again, without going into the actual figures, peanuts. It will cost them about, for the 1,000 or 10,000, it will probably cost them maybe 1,000, maybe 2,000 at the most. For 20 employees, it will probably cost them about 1,000. All right.
Yeah.
Here's the kicker. A lot of companies say or give lip service to, oh, like we care about our employees. You know what? Give this product chatbot to your employees for free when they join or as part of all the employees at this point in time. Give it to them for free. They feel they've got a companion. They don't need to talk to anybody. They don't need to call up those EAP insurance products that they have in companies' insurance policies, blah, blah, blah. They've got it all at hand. If they need to then call other people, they can either go through the insurance process or pay through the chatbot to get a local doctor to call you and qualified doctor, vetted, etc., to call you. So that's it. The benefit for the employer is everything now gets reported through the chatbot straight to HR. The boss doesn't need to be involved. The boss sometimes not even there when you call them, etc. And as I said, this is 24/7. Okay, this thing doesn't sleep. Okay, so those are the big picture benefits. In terms of research, what we're going to be carrying out some research now in Switzerland, etc. But in terms of the research, what we expect, okay, from our own sort of analysis, etc., and other studies along similar lines, but not the same thing, is that with the alternative medicine, the support, etc., we're looking at a decent percentage in terms of sick days reduction, possibly up to 30%, but I don't want to make that out there. Even if we get 1 or 2% or 5%, which is a no-brainer, it will still have a big impact on the payroll. So it makes financial sense to give it to your employees. Okay, it will offload a lot of HR admin and automate the whole sick reporting process, which currently at the moment is highly manual. It's real-time reporting. Okay, and it also promotes. So within our chatbot, it's got diet plans, it's got your gym plan, it's got all sorts of other stuff in there. And I will be also, because I've got a coaching business, I will also be putting my coaching sessions on there as a repository for, the wheel of life balance, a 10-minute technique, which I call the Dickens process, which I learned from Tony Robbins, which is to show you how to get rid of toxic relationship. I will literally show people how to get rid of a toxic relationship. It's called NLP, it's programming of your brain. But when you think of a positive person, you think, wow, okay. When you think of a negative person, you get depression. But by the time I finished with their 10-minute process, they'll be able to look at both sides of their hands and say, okay, when I think of that negative person, I still have very powerful thoughts. So, so and it's all private. It's access, for emotional support, etc. You can go to the chat bar. You don't have to disclose to anybody you're going for that, etc. And if early intervention is required, it will escalate that process very quickly within the first 3 days in terms of the next call, etc.
I think it's fascinating. I really do. Eric, have you got anything you'd like to add? Maybe.
Yeah. On the privacy side, which is something that's really important given the type of data that we're handling over here, something I want to say is that people may think that this is less private than the usual process. Because they may say, oh, well, now my boss can see everything I ask about my health. 2 points to make about this. First point is, no, your boss can't. Chatbot is made in such a way that only the chats where a sick leave is required are transmitted. Data is anonymized, so the person at the end can see, okay, Jonathan needs to take sick days, but no one in the middle can. And if you think about it, and as a second point, a normal process means that your boss knows why you're sick, why you're off, and everything. Multiple people in HR, perhaps people in management. Things get around pretty quickly if you do it, let's say, the normal way. With the chatbot, people just know what they need to know as a bare minimum, so you can keep your privacy protected. And also everything that is non-sick day related is never going out to anyone. It's just going to stay with you and no one else, which is something that we're really proud of being able to ensure that our clients' data and perhaps personal information stays safe.
And I think that is a huge, huge point, because that is everyone's concern initially when we're talking about new AI products is it secure? Is my data secure? And then I guess what you guys have got to think about as well is the ethical side of it, obviously the governance as well, and complying with EU AI acts and things. So I can imagine there's a lot of plates you're spinning right now that that you have to consider. But I think it is such a powerful product, and I think one that I think for the cost is really, really cheap for small to medium business. I don't know what the enterprise business looks like, whether you're targeting that area as well, but certainly it makes a lot of sense. Employees feel great, and you'll see a spike obviously in how employees are feeling, and reduction in sick days as well, I would expect. So I think it's just a really, really fascinating product, guys. Thanks so much for sharing.
So Jonathan, just on that, a couple of things I would add. Eric, correct me if I'm wrong as well. So there is, in terms of our product delivery, there is another arm to all of this, which what we call high-end big ticket consultancy. So high-end big ticket consultancy, because of our Swiss background, one of our founders is in Switzerland, who actually works in this field, where they actually go to healthcare, private and public organizations. And if you can imagine how many healthcare private organizations, i.e. nursing homes, blah, 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 they go in and assess the whole business process from start to finish in terms of patient healthcare. And then they will automate that using technologies, including AI. And there you're talking, depending on the size of the project, etc., sort of 50K upwards consultancy fees. Okay. We haven't even covered that, and we've got other things we want to cover, but that's the big ticket items. The second thing is that, you know, genuinely, if everybody chipped in, so the other thing is, you know, if you run this for a pilot of 3 months or a whole year, ideally, you know, a company will be able to see how many sick days they had at the start of the previous year or for the previous year, and they will be able to see how many sick leave days they have for. Again, this is the finance coming out. You know, you compare last year to this year, and so you know, but the whole thing is automated. And we can then produce reports that are automated to split out for management justification of why they've got invested in this, albeit peanuts, into this whole process, etc. I haven't even started talking about charities yet. The other area is charities. There are a lot of mental health and, you know, running, and you know, I've walked for many charities during my 100K walks, etc. You know, but there are a lot of charities that have got a lot of people as followers or subscribers or whatever you want to call it. Okay, they've got big data sets, right? Another avenue we will be pursuing is to go into these charities and say, look, you know, what's your favorite charity? Obviously, the charity is whatever, you know, children's charity or whatever it may be. It doesn't really matter what the charity is. Okay, fine. So, you know, if we can give this chatbot to all your followers for free, 3 questions a month for free, and if they want to upgrade, that's great. But if they upgrade, we will also contribute to your charity as a percentage of our revenue flow using your promotion code as our brand ambassador. So brand ambassadors, etc., are what we're looking for. Okay, we're looking for doctors and all sorts of professions to come onto our platform to be able to give their service for a price to people who need that additional one-to-one, etc. So there are so many, you know, there are so many levels to this business. Okay, and I'm spinning all of those plates at one time and giving Eric such a hard time because he's up till 2, 3, 4 o'clock in the morning trying to meet my demands, to saying I need all of these things and I don't want it hard coded. I want the flexibility, but I do not want anything hard coded, because tomorrow our business model could be completely not different from where we are, but because I've designed financial systems, etc., we cannot hard code things and create a rod for our back.
Well, look, you go easy on Eric, Jitendra. I know he does need his sleep, otherwise he'll be increasing his sick days, I'm sure. So you go easy on him, mate.
Look at he looks like he's just come out of school. Look at me. I mean, he looks like he's come out of school. If I think what I'm doing is I'm keeping him young. Look at him. He's like
That's
still young, right?
That's it. Them grey hairs will soon start approaching, mate. They hit me at the age of late 20s. So but you know, there you go. But look, guys, I'm really loving the ESB AI chatbot. I feel like it's just such a powerful tool, and I wish you all of the success. If there's anything I can do to help, you know, spread the word, launch things, then I certainly will be trying to do so anyway. But thanks very much for your time, Eric and Jitendra.
So Jonathan, at the end of the information we've sent you, and thank you for that, there are 3 or 4 links we've sent you